This evening, 11 cases of monkeypox reported across the Sooner State, 4 of them here in northeastern Oklahoma. And as the White House declares a state of emergency, 2 News Oklahoma's Jeanette Quesada talked with people with the State Department of Health and the Tulsa Health Department about the virus and the trends they're seeing here in the Sooner State. Jeanette?
Karen, I spoke to leaders about the signs and symptoms, how the virus spreads, and why the state requested under 15% of the total number of vaccines available from the federal government.
Monkeypox is a pox virus that causes a rash.
Health experts say aside from a rash, symptoms include fever and things like headache, muscle ache, chills, and fatigue. And although those symptoms can seem like the flu, it's spread differently.
We are seeing a lot of cases in this outbreak are associated with close intimate contact, sexual contact.
But state and local officials say a simple handshake with someone who has lesions on their hands can spread the virus too. That's why they say vaccines are very important.
It reduces your risk for getting monkeypox, and therefore if you're reducing the risk of getting the infection, and then you're going to reduce the risk of transmission as well.
There are 2 approved vaccines for prevention of monkeypox. The federal government allocated 5,555 dozens of the Jynneos vaccines for the state of Oklahoma. Of those, the State Department of Health has only requested 436. Kendra Doherty with the Oklahoma State Department of Health says the vaccine requires specific handling and storage, so the state requests as it sees necessary.
The treatments really are reserved for individuals who are symptomatic and either at high risk for severe complications or are positive.
With quarantine and isolation guidelines fresh in the minds of Oklahomans, Doherty says monkeypox is different, spreading more slowly. While the World Health Organization recently said more than 90% of cases are among gay and bisexual men, health experts say anybody can be exposed, and we all need to stay aware.
From COVID, we have learned that things can change over time with some of these outbreaks, right? And so just, staying on top of what is recommended for you.
And new tonight, people with the State Department of Health tell me they're working with the University of Oklahoma to test wastewater to get a better picture of the number of cases in the state. They tell me they'll be releasing more information once they have interpreted that data. In studio, Jeanette Quesada, 2 News Oklahoma.